Welcome to another episode on ADHD, Focus and Motivation. Today, we're embarking on a profound journey into the depths of a topic that's crucial yet often overlooked: the secret link between ADHD and sensory sleep disorders. For those navigating the complex world of ADHD, sleep isn't just a routine. It's a challenge, a mystery to be solved. Join us as we unravel this mystery, offering not just insights but solutions that promise a better night's sleep. To fully grasp the magnitude of today's topic, we must first understand ADHD's nuances. It's a condition marked not just by the well-known trio of inattention, hyperactivity, and impulsivity, but also by a myriad of underlying factors that affect every aspect of life, including sleep. And when we introduce sensory sleep disorders into the mix, the puzzle becomes even more intricate. Let's delve into this complex interplay and discover how it impacts those with ADHD. ADHD affects the brain's executive functions, which include organizing, planning, and most importantly for our discussion, regulating sleep patterns. But ADHD doesn't stop there. It also influences how the brain processes sensory information, making individuals more sensitive to environmental stimuli that can disrupt sleep. Sensory processing disorders, SPD, and attention deficit hyperactivity disorder, ADHD, often intersect in ways that significantly impact individuals' lives, creating a complex web of challenges that go beyond the traditional symptoms of ADHD alone. Sensory processing disorder, a condition where the brain has trouble receiving and responding to information that comes in through the senses, can manifest in either hypersensitivity, over-responsiveness, or hyposensitivity, under-responsiveness, to sensory stimuli. This can include reactions to textures, sounds, lights, and other sensory inputs that most people would find non-irritating or might not even notice. Individuals with ADHD often face a unique set of sensory triggers that can vary widely from person to person, but some common ones have been frequently observed. Auditory stimuli, such as background noise or sudden loud sounds, can be particularly disruptive, making it difficult for those with ADHD to maintain focus or stay calm. Visual triggers like flickering lights or overly bright screens can also lead to discomfort and distraction. Tactile sensitivities are common as well. Certain textures in clothing or food can feel intolerable, leading to irritability or avoidance behaviors. Furthermore, crowded or cluttered spaces can overwhelm their sensory processing, contributing to feelings of anxiety or restlessness. Even olfactory triggers, such as strong or peculiar smells, can be distracting or cause discomfort. Recognizing and accommodating these sensory triggers can be a crucial step in managing ADHD symptoms and improving the overall well-being of those affected. For individuals with ADHD who already navigate difficulties with attention, impulsivity, and hyperactivity, the added layer of sensory processing issues can intensify their daily experiences, making environments that are typically manageable overwhelmingly distressing or distractible. The overlap between SPD and ADHD can complicate diagnosis and treatment, as the symptoms can appear similar or intertwined, leading to challenges in identifying the root cause of certain behaviors or reactions. For instance, a child with ADHD who is also hypersensitive to sensory inputs might find the sensory-rich environment of a classroom not just distracting but also distressing, exacerbating their ADHD symptoms such as inattention or impulsivity. Conversely, a child who is hyposensitive might seek out additional sensory stimulation, which can manifest as fidgeting or hyperactive behavior, often seen in ADHD. Understanding the nuanced relationship between SPD and ADHD is crucial for developing effective strategies for management and support. Tailored approaches that address both sensory sensitivities and ADHD symptoms can significantly improve outcomes, allowing individuals to navigate their environments more comfortably and effectively. Sensory sleep disorders are a group of conditions where the processing of sensory input affects sleep quality. Imagine trying to sleep in a room where the lights flicker, the sheets feel like sandpaper, and every sound is amplified. This is the nightly reality for some with sensory sleep disorders. First, let's talk about insomnia, a condition where either falling asleep or staying asleep feels like an insurmountable task. It's more than just occasional restlessness. It's a persistent struggle that can exacerbate ADHD symptoms due to lack of rest. Insomnia is a prevalent and particularly challenging issue for many individuals with ADHD, manifesting in difficulties with both falling asleep and staying asleep throughout the night. The hyperarousal state often associated with ADHD can make it hard for the brain to transition into the relaxation needed for sleep, leading to prolonged periods of wakefulness and a restless mind that seems to race with thoughts, ideas, and sometimes worries. Moreover, the dysregulation of neurotransmitters like dopamine, which plays a crucial role in both ADHD and sleep-wake cycles, can exacerbate sleep disturbances, creating a vicious cycle where poor sleep further aggravates ADHD symptoms. The impact of insomnia in those with ADHD extends beyond mere sleeplessness. It can significantly affect daytime functioning, exacerbating issues of inattention, impulsivity, and emotional regulation. Addressing insomnia in the context of ADHD therefore requires a multifaceted approach, focusing not only on sleep hygiene practices, but also on the management of ADHD symptoms through therapeutic interventions, behavioral strategies, and when appropriate, medication. Then there's restless leg syndrome, RLS, a disorder characterized by an overwhelming need to move the legs, usually accompanied by uncomfortable sensations. These sensations typically worsen during periods of rest or inactivity, particularly at night. Restless leg syndrome, RLS, presents a unique set of challenges for individuals with ADHD, intertwining neurological and sensory issues in a way that can significantly disrupt sleep and overall quality of life. Characterized by an uncontrollable urge to move the legs, often accompanied by uncomfortable sensations like itching, tingling, or aching, RLS can make the act of lying down to rest or sleep an ordeal for those affected. For individuals with ADHD who may already struggle with hyperactivity and an inability to relax, the added discomfort and compulsion to move associated with RLS can exacerbate their symptoms, particularly at night when the body should be winding down. The interplay between RLS and ADHD can also affect daytime functioning, as the sleep disturbances caused by RLS can lead to increased fatigue, which in turn can worsen the attentional deficits and impulsivity characteristic of ADHD. Managing RLS in the context of ADHD thus requires a holistic approach that addresses both the sensory and motor aspects of RLS as well as the core symptoms of ADHD, often involving a combination of pharmacological treatments, behavioral interventions, and lifestyle modifications to alleviate the symptoms and improve overall well-being. And we can't forget about sleep apnea, a condition marked by pauses in breathing during sleep. These interruptions, often unnoticed by the individual, lead to fragmented, non-restorative sleep, leaving one exhausted during the day. Sleep apnea, a condition characterized by repeated interruptions in breathing during sleep, poses significant challenges for individuals with ADHD, compounding their struggle with restlessness and fragmented sleep. These disruptions, typically marked by loud snoring, followed by periods of silence and a gasping or choking sound, lead to poor sleep quality and a decrease in oxygen levels, which can exacerbate ADHD symptoms such as inattention, impulsivity, and difficulty in regulating emotions. The daytime fatigue and cognitive impairment resulting from sleep apnea-induced disrupted sleep can mirror and magnify the executive functioning challenges already faced by those with ADHD, making it harder to concentrate, organize, and complete tasks efficiently. Given the overlapping symptoms and the bidirectional impact of sleep apnea and ADHD on each other, it's crucial for healthcare providers to screen for sleep apnea in individuals with ADHD who exhibit persistent sleep-related issues. Addressing sleep apnea through interventions like CPAP therapy, lifestyle changes, or surgery where applicable can significantly improve sleep quality and, by extension, the management of ADHD symptoms, leading to improved daily functioning and overall quality of life. Now let's bridge the gap between ADHD and these sensory sleep disorders. Research indicates that ADHD is not just a surface-level challenge of focus and hyperactivity. It deeply affects sensory processing and sleep regulation. This means that individuals with ADHD are more prone to the disruptions caused by sensory sleep disorders, creating a feedback loop of sleep challenges and ADHD symptoms. A key player in this complex interplay is dopamine, a neurotransmitter that's crucial in regulating mood, attention, and sleep. Dopamine, a key neurotransmitter involved in reward, motivation, and attention, plays a central role in the struggles faced by individuals with ADHD. This neurotransmitter helps to regulate mood, attention, and executive functions such as organizing and planning. In ADHD, the dopamine system is often dysregulated, leading to the hallmark symptoms of the disorder: such as difficulty maintaining focus, impulsivity, and a constant search for stimulating activities. This dysregulation is believed to stem from several factors, including lower levels of dopamine, reduced activity of dopamine receptors, or the inefficient transport of dopamine in certain areas of the brain. The result is a neurological environment where the reward and motivation systems are off balance, making it challenging for individuals with ADHD to find satisfaction in routine tasks, maintain attention on non-stimulating activities, and regulate their responses to external stimuli. Dopamine's influence extends beyond daytime activities and cognitive functions. It also plays a critical role in regulating sleep-wake cycles. Dopamine levels naturally fluctuate throughout the day, with higher levels promoting wakefulness and lower levels facilitating sleep. For individuals with ADHD, the dysregulation of dopamine can disrupt these natural rhythms, leading to difficulties in transitioning from wakefulness to sleep. This can manifest as insomnia, where the person finds it hard to fall asleep due to an overactive mind or inability to relax, or as disturbed sleep patterns, where the individual might wake up frequently during the night. The sleep disturbances associated with dopamine dysregulation in ADHD not only worsen daytime symptoms by increasing fatigue and reducing cognitive function, but also create a cycle where poor sleep further disrupts dopamine pathways, exacerbating both sleep and ADHD symptoms. Addressing dopamine dysregulation through targeted treatments such as medication, lifestyle changes, and behavioral interventions can therefore have a profound impact on improving both the core symptoms of ADHD and associated sleep issues, leading to better overall functioning and quality of life. Despite these challenges, there's a silver lining. By adopting targeted strategies, individuals with ADHD can manage sensory sleep disorders and improve their sleep quality. Creating a sensory-friendly sleep environment is key for individuals sensitive to sensory inputs, particularly those with conditions like ADHD, where such sensitivities can exacerbate sleep difficulties. This involves tailoring your sleeping area to minimize sensory disturbances and promote relaxation. Start with the visual aspects. Use blackout curtains or shades to block out intrusive light, and choose calming, muted colors for walls and bedding to reduce visual stimulation. For auditory sensitivities, consider a white noise machine or earplugs to drown out disruptive sounds from the environment. The tactile aspect is also crucial. Choose comfortable, breathable bedding materials that feel soothing against the skin and ensure the mattress and pillows provide adequate support without being too firm or too soft. Temperature control is another factor. The room should be kept at a comfortable, cool temperature, which might involve the use of fans or adjusting the thermostat. Additionally, reducing clutter and electronic distractions can help create a calming atmosphere conducive to sleep. By addressing these sensory aspects, the sleep environment becomes a sanctuary, inviting rest and relaxation, and facilitating a deeper, more restorative sleep. But the journey to better sleep doesn't end with your environment. Behavioral and lifestyle changes play a pivotal role. Establishing a consistent sleep routine signals to your brain that it's time to wind down, acting as powerful tools to align the body's internal clock and enhance sleep quality. Adhering to a regular bedtime and wake-up time, even on weekends, helps to regulate the body's circadian rhythms, making it easier to fall asleep and wake up naturally. Creating a pre-sleep ritual, such as reading, meditating, or taking a warm bath, can signal to the body that it's time to wind down, easing the transition into sleep. Limiting exposure to screens and blue light in the evening is crucial, as they can interfere with the production of melatonin, the hormone that regulates sleep-wake cycles. Engaging in regular physical activity during the day promotes physical fatigue, which can aid in falling asleep more quickly, but it's important to avoid vigorous exercise close to bedtime as it can be stimulating. Additionally, mindful dietary choices like avoiding heavy meals, caffeine, and nicotine close to bedtime can prevent discomfort and stimulant effects that disrupt sleep. Implementing these behavioral and lifestyle adjustments fosters a conducive environment for sleep, making a consistent sleep routine not just an aspiration but a sustainable practice. Reducing screen time before bed minimizes exposure to blue light. The impact of blue light emitted by screens on melatonin production is well known. Melatonin is a hormone that plays a key role in regulating the body's sleep-wake cycle, signaling to the brain that it's time to sleep. Blue light, which is abundant in electronic devices like smartphones, tablets, and computers, can significantly suppress melatonin release, thereby disrupting the body's natural sleep rhythms. Exposure to blue light in the evening can trick the brain into thinking it's still daylight, leading to difficulties in falling asleep and a decrease in sleep quality. By establishing a screen curfew an hour or two before bedtime, individuals can minimize this disruption, allowing natural melatonin levels to rise and promoting a more restful and uninterrupted sleep. This simple yet effective change can be complemented by engaging in relaxing activities free from electronic devices, such as reading a book or practicing relaxation techniques, further preparing the body and mind for sleep. For some, the path may also involve medication or therapy. Medications can address underlying issues like dopamine imbalance, while therapies, particularly cognitive behavioral therapy for insomnia, CBTI, offer tools and strategies to combat insomnia and other sleep-related challenges head-on. As we conclude our journey through the intricate world of ADHD and sensory sleep disorders, it's clear that while the challenges are significant, so are the opportunities for improvement. Armed with knowledge and the right strategies, anyone can transform their night, turning a time of restlessness into a haven of restorative sleep. If today's episode has enlightened you, ignited a spark of curiosity, or offered comfort, please share it with those who might benefit. Subscribe for more content that empowers and educates, and together, let's continue to unravel the mysteries of ADHD. Thank you for watching, and remember, every night brings a new opportunity for peace and rest.